We'll move now to our live demo. And we're going to present the E-rounds. I'd like to welcome Edward Chu. So Ed is the Emergency Medicine Advisor for MSF Amsterdam and Geneva, and he's also the founder of the Berlin Knowledge Lab. He has a bachelor's degree in cultural anthropology and a master's degree in international health system financing, and in a previous life worked in the field of philanthropy, providing grants and advocacy training to grassroots community health projects before he found his calling in emergency medicine. Ed will give a live demo on the E-rounds initiative.
The E-rounds is an activity of the Berlin Knowledge Lab that focuses on bringing distance continuing professional development to our projects in the field. The E-rounds consist of monthly interactive lectures that vary from traditional grand round style presentations to fully interactive simulation exercises with field projects. Let's listen to Dr. Nitya tell us about what she sees as the impact of this activity.
As an example is how they had a webinar on the pathophysiology of shock and how to manage shock. And it was just with simple things, how they could differentiate just by checking the pulse, with using just basic clinical knowledge, that they were actually able to take the knowledge that they got from this webinar to actually save a life.
Clinical case-based learning makes up a large part of the E-round activity. In the breakout rooms, we have introduced exercises for simulation to our projects and allows us to really focus not just on presenting information, but helping project staff to integrate it and use it in a case-based approach. Let's see some of the examples of breakout room exercises.
So I'm going to show you the first case. It involves a video, so I'm first going to show you the video. Okay, let's discuss. What do you think? Is it a longitudinal view or maybe a transverse view?
Yeah, what I see here is a transverse view of the uterus.
To see. So you said no spontaneous breathing, yeah?
Yeah, no spontaneous breathing, yeah. It's no spontaneous breathing.
Yes.
So what we can do now?
It's rescue breathing. Rescue breathing.
Rescue.
Five rescue breathing.
Patient adult with gunshot in abdomen. What do we do?
هل المريض قادر انه يتمشى ولا مش قادر يتمشى؟ Okay.
The logistics of these activities are fairly simple. Each month we identify a topic, confirm a speaker, and work with the focal points in the projects to arrange for the participation of their medical staff with the activity. We organize a preparation session where we go over the topic and the interactive activity that we're going to do during the breakout room, and then follow each session with a debriefing with the focal points to see how we can improve on the activity on a regular basis. So as we can see, the focal points are really an essential part of this activity and really elevate it and allow us to do things that are much more engaging than we would otherwise be able to do with a traditional webinar. Each project that participates has to identify at least one focal point to coordinate logistics. They also help to make sure that the equipment needed is there, but their most important role is in animating the activities that happen during the breakout rooms. They're the ones that are there with their team and really put into practice the tools and cases that we provide to really make it more than just an activity of listening to a lecture. Here we hear some feedback from one of our focal points, Duha, who is the medical activity manager in the Adahi project.
About it. And also for the E-rounds, it was really, really so interesting for everyone here in Adahi, especially when we was participating with you. So the guys was holding their books and paper, sitting, together in the room, and they said after that, oh, look, we participating with Geneva. Oh, someone talked to us.
So I don't think we could say it any better than that. So thank you so much for listening to this presentation, and we look forward to those of you who will be joining us tomorrow for the Neglected Tropical Diseases year-round experience that we are doing in collaboration with the Pediatric Working Group. Thanks so much.
Fantastic. What a great initiative. And Ed will be available during the conversations over coffee break, so you can ask him some questions during the break.